Thank you. Thank you everyone for joining today at our healthcare roundtable focus on mental health awareness. So today we want to really thank our sponsors, Sweeney Hospital, Community Health Network, and UTMB Health. I want to thank them for attending this and sponsoring this webinar today. So today we have Gracie Pequeño that's going to be our moderator for today. Gracie Pequeño is one of our board members. So Gracie, go ahead and take over.
Thank you, Gina. Good morning. Welcome to May's Mental Health Awareness discussion. We've got 3 great candidates that will be speaking to you about mental health. We have some pre-prepared questions, but please feel free to put some questions in the chat box and we will address at the end of this webinar. Let me introduce you to our candidates. We have Nidia Elena Garcia. She's with the Community Health Network. We have Jesus Guevara with Sweeney Community Hospital. And we have Dr. Jeff Temple. And let me be the first to say congratulations, Dr. Temple, on receiving the 2021 Prevention Science Award from the Society of Prevention Research. Congratulations. So without further
Thank you so much. That was sweet. Thank you.
Thank you. Thank you for your efforts and research. We really appreciate. So without further ado, I'm going to give each candidate an opportunity to just a brief discussion or a brief little overview of themselves before we begin with the first questions. Dr. Temple, we can start with you.
Okay, great. Thank you. So just to tell people about myself, huh? So I am a professor and psychologist at UTMB Health. I'm in the Department of OB-GYN, mostly work on issues related to relationships, so healthy relationships as a way to be healthier and happier overall in life, and really focused on preventing unhealthy relationships like dating violence and domestic violence. So most of my work is school-based and community-based, where we are focused on preventing youth violence as a mechanism for preventing sort of bad ways of relating, future domestic violence, and also reductions in things like substance use and risky sexual behavior.
Thank you, Dr. Temple. Jesus?
Hello, my name is Jesus Guevara. I am a licensed professional counselor working out of Sweeney Community Hospital. I've worked in a variety of settings. I've worked at inpatient facility there in the Rio Grande Valley when I was doing my graduate work, working with, again, anything from severe schizophrenic patients to, again, bipolar as well as suicidal again, risk and tendencies. And then after that, I went into a nonprofit organization in Houston, Family Services of Greater Houston, and I worked in the schools. I actually went into middle schools and did individual as well as group therapy with, again, 6th, 7th, and 8th graders. Again, the teachers as well as the counselors there identified as at risk. And so we worked on a variety of psychoeducational topics and things like that. And then in 2014, I came to Sweeney Community Hospital, and I've been working here since. And we have a older adult program for 55 and older. Basically, that's the main program that we do. It's basically working with, again, depression, anxiety, bipolar, grief and loss, life road transitions. As we know, in that stage of life, there definitely is a lot of transition, probably matching to that of a middle schooler. A lot of change, both wanted and unwanted, in regards to kind of loss of independence and things like that too. So we work with them as well as, again, help them with medication management through our medical director, Dr. Romana Surya. And so, again, it's definitely a good program that's available to the community that, again, I've seen some very good, again, benefits helping the older population that I think needs just as much, again, healthcare, mental health, again, treatment as any other population for sure.
Great, thank you. Thank you. Nidia?
Good morning, everyone. My name is Nidia Elena Garcia, and my background is in public health. I had my master's in public health, and my professional background comes actually from quality and patient safety. I have 10 years healthcare management experience, and 6 of those years in quality and patient safety. I previously worked in an FQHC, so a community center in the Fort Bend County, working with the quality aspect of healthcare, and transitioned for the last 4 years working on the hospital side. Being in the hospital side, we saw a lot of patient safety and quality issues in relation to mental health, behavioral health. I became especially interested in the prevention of crisis and really began to redirect my focus to outpatient management of behavioral health. And so in November of 2020, I joined Community Health Network, which is a robust outpatient clinic management program. We do have a team of 5 psychiatric nurse practitioners, 1 psychiatrist, medical director, and then also a team of 12 therapists and growing. We are located at over 10 clinic sites and also provide virtual care and access across the state of Texas. So being with Community Health Network, we are expanding into same-day services are some of our initiatives. We have group therapy, and it's been very exciting to partner with the community and get the word out about prevention and being able to have good outpatient management of our mental health in the community.
Great. Thank you. Thank you for that. So we will go ahead and get started. So we have some questions prepared. I'm going to read the question, and then whomever wants to take on the first one, feel free to unmute and take over. First question. What are some identifiers that can be observed to help in determining someone who may be experiencing mental health distress and could benefit from services to prevent their condition from worsening?
I'll go ahead and start, and then someone could fill in. But I promise not to always start. So, I think when we look at identifiers and when we think of mental health, oftentimes we think of someone that is schizophrenic or hallucinating or seeing things, but that's rarely the case. It's usually, especially in the community, it's more of the walking wounded. So they can still function, they can still, go to work, have relationships, but maybe they're, more depressed, more down. And what does that look like? Well, it doesn't always mean that they're crying all the time or even crying at all. It could mean that they just lose interest in stuff they used to be interested in. So if they used to like going to the beach and hanging out, now they just would rather just do nothing and stay at home. It could also be anxiety, like excessively worrying about stuff and coming back to that same worry over and over again. Or if it's something like a trauma that have affected them in the past, maybe it's reliving that in the forms of continuing to talk about it or to have nightmares about it or anything like that. So that's just a few examples. I'm certain that my colleagues have other thoughts on this.
Yeah, I mean, I guess when I go into the groups and when I work with anybody, I kind of go into them with the idea that, again, unfortunately for mental health, there's no clear, way of measuring it. Again, I always tell them, I wish we had a thermometer for depression and anxiety like they do at doctor's offices, or a blood pressure cuff for, again, anxiety or depression. Okay, you're 50/30, you need to definitely work on improving that. But again, like Dr. Temple said, again, I think it's a matter of looking at what we can observe. And really, again, what we talk about is our thoughts, our feelings, and our behaviors. That's how we measure, again, someone's mental health. And so with behaviors, a lot of times we look at even their sleeping habits. Again, are they having trouble sleeping a little bit more often than usual, sleeping too much or sleeping too little? And so it's also on a spectrum, because I think, again, with anything, you can do it too much or you can do it too little. Same thing with eating habits. Again, there's some that, again, when they're depressed, they experience, again, increased eating, some decreased eating. And so I think those are some very observable ones. Like, again, if you're around family members or somebody, and again, you notice, they're not really themselves, their eating habits, they look tired more. And again, like Dr. Temple said too, that interest, if normally you invited them out and they'd be jumping at the door to come, and they're like making excuses or basically trying to stay to themselves more, that's usually another indicator, I think, a behavioral indicator that can let us know, again, that there's something kind of going on with them.
Yeah.
And so, like I said, again, I think that's kind of the thing that we always look at, the thoughts, feelings, and behaviors that indicate, again, like you said, and they're not going to be as overt. And the truth is, a lot of people are very good at hiding it. I think we all wear masks to a certain extent in regards to trying to, again, not show that we're struggling with something. And again, as we know with mental health, that stigma and that shame can sometimes kind of cover it up a little more, be a motivator to cover it up a little bit more. So again, but as far as like some more obvious ones, some more common ones, those are the ones that we a lot of times see with people kind of, and then making statements like, I just don't feel like myself lately. I just don't feel like, again, this isn't what I normally would do if it was, if I was in the right state of mind or right mood kind of thing.
And now we're literally wearing masks. So
Yeah.
yeah, I would like to just mention one thing that Mr. Guevara said that was really important is it's change, right? So if you're eating more or less, or sleeping more or less, or more grumpy or less grumpy, I always talk about my daughter. If she started to be nice, then I would start to worry, right? So it's the changes that's most important in previous behavior.
I think the most important thing for friends and family, if you're wondering or maybe even dismissive that one of your loved ones might possibly be struggling with anxiety and depression, is just like they were saying, the appearance of a happy face or a smile may or may not actually be an indicator. So kind of just asking every once in a while your loved ones those questions about how are you doing? And the first thing to do when someone might be sharing some areas that they're struggling with is that they feel seen and they feel heard. That social support is so important. And there's a lot that we can do as friends and families in encouraging our loved ones to seek out that professional support. Our medical community and our trained clinicians, they're going to be that support in the clinic, but as friends and families, we can provide us support at home to encourage them to seek out those services.
Yeah, that's wonderful information. That really gives us a good insight of what to be aware of. Now, what are some things we should not be doing um, when it comes to preventing or seeing somebody who may be having some experience of different behaviors, different thought patterns? Is there something that we should not do?
Well, I said I wouldn't start, and I promise I won't. But this time, it struck me that this is the thing that I think a lot of people try to are dismissive about mental health symptoms. And so, with someone with a fever or with cancer, we wouldn't say, "Oh, you'll be fine. It'll get better. You'll get over it," or you just gotta feel better. You just gotta do this, and it's with mental health, it's no different. It's difficult and it's hard. And so I think recognizing that and affirming that difficulty with them and helping them get support as opposed to just being like, oh, it'll get better, everything's fine.
Yeah, I definitely agree. Again, Dr. Temple, in regards to just, again, the do's and don'ts. I mean, again, I think it varies. It's relative depending on the situation. But again, definitely being very supportive, trying to show compassion as opposed to judgment or criticism. Even, again, there's relatives and family members that, again, will, again, give some kind of, again, comfort, but not realizing that maybe it's at the same time making them feel negative for even expressing themselves kind of thing. And not that they're doing it on purpose, but again, watching what we say and how we say it sometimes a little bit more carefully than we would with somebody else kind of thing that's not struggling with that. Because again, it's true, again, with, again, somebody with physical medical health issues, again, you're not going to kind of tell them the same thing you would sometimes if they're dealing with a anxiety or depression related kind of issue. And so I think a lot of times it's also, again, be constant, be very consistent in their lives in regards to, again, you may follow up with them like Ms. Garcia said, being very supportive and being involved with them. If you see that they're definitely struggling or showing some of those signs, is again, don't check in one day and then wait for a week and kind of, because we sometimes assume the same thing that, oh, it'll pass even without saying it. And so we'll kind of put it to the back burner and forget that they were struggling, and then it gets worse kind of thing. So I think they enjoy when they see it's consistent. Oh, okay, they're checking on me. They don't feel as alone. And I know that's one thing with mental health that a lot of people report is just that feeling of alone, like nobody will understand them or nobody will be able to relate to them. And so being able to empathize and also kind of even kind of say, you know what, we all struggle with that to a certain extent. sometimes it gets a little worse for some, and just a matter of understanding and giving that compassion and also that consistency, I think will help, again, them maybe get through it a little bit better than if they didn't have that.
Absolutely. And I think the important thing to remember is the individual that may be struggling, their feelings are valid, and a lot of time very caring friends and family want to give a fix, want to give advice, or kind of say a blanket statement in order to help the individual quickly overcome whatever feeling or symptoms they might be experiencing. I think the important thing is to remember that empathy and listening goes a lot further than those attempts at advice. Listening is really the best thing that we can do as friends and family, and just having a presence and, like Jesus was saying, checking in on them and being consistent, that's really going to demonstrate to them that care and that support from a family and friends social structure.
That's great information. I like the thought process of don't be dismissive. I think one of you mentioned also about the stigmas that are related. We definitely don't want to shame anybody. We wouldn't shame somebody having a fever, like you said. But like Jesus had mentioned, there's not a way to measure somebody's mental health with a blood pressure cup or thermometer. So I think that's really good information to know.
And I think related to that is we're all biased in here, but I assume y'all would agree with me that I think everyone should have a primary care mental health professional, just as everyone has a primary care physician.
Yes.
100%, Dr. Temple. And one of the things that we're working on in our clinic is integration of services. So what we've noticed and what we're on the dawn of is realizing that individuals who have difficulty being compliant with their medication management, whether it be hypertension, diabetes, there more than likely may be an underlying mental health factor that can be addressed. Having that designated therapist or even psychiatrist on their care team. And so that's been part of our approach here with the clinic. You're absolutely right, is making sure that they get that connection and that handoff. I believe that it's been mentioned in this conversation regarding the stigma. And so one of the ways that we've been attempting to reduce the stigma is by saying, this is part of your care package. This is part of your welcome package to our clinic. Everyone gets this. This is totally normal. This is what it means to be a patient of ours. Recognizing that need, that everyone does need therapy. Everyone does need psychiatry. And so that definitely is one thing that's been helping our community and our patients.
Yeah, I definitely, again, agree with that in regards to, again, and I know I've worked with, I actually had my supervisor when I was doing my internship hours, actually used to work for the clinic there in Freeport, the Stephen F. Austin Clinic. And again, I know, again, he would always talk about the programs that they were opening up, again, going into the schools and providing, again, mental health there in the schools as well, again, as an added resource to what they already have. Because as we know, again, the schools, again, they have counselors, but again, a lot of times they're relegated to doing, again, other stuff as opposed to focusing on, again, mental health and how the students are doing. And so I definitely think, again, yeah, everybody could benefit, whether it's, again, professional counseling, or I know a lot of our patients, again, they'll talk about pastoral counseling. Again, they go to their church and, again, get a lot of, again, their treatment, again, through there in regards to, so whether it's this or that, I think it's a matter of recognizing what it is and what it isn't, and realizing you probably do it, but not in a professional kind of way that some people would expect it, kind of thing. And so normalizing it, I think, is definitely helpful, and just showing that everybody needs it. Just like everybody has blood pressure, everybody has a level, again, of emotional kind of stability that sometimes it gets out of whack, and we need something to manage that, whether it's therapy or whether it's also medication to add to that. Because again, I tell patients all the time, again, you don't take a medication for blood pressure to get rid of your blood pressure. You take it to manage and stabilize it. And so again, you don't question that, but why question a medication is meant to stabilize your mental health? Again, there's chemicals, there's something else going on that, again, therapy won't be able to help as much, but again, medication will. It will offset that, just like it will do for diabetes, just like it will do for cholesterol and blood pressure. Again, it's not going to get rid of the problem, but it will help manage it. And so that's another thing I think it's very helpful to kind of let people know and educate them in the beginning. When they come to our program, we tell them, coming here is not going to get rid of your depression. It's not going to get rid of anxiety. We're not robots. We're going to have those for basically our whole lives. And sometimes it's going to increase, sometimes it's going to be managed. And so I think that's important too, to help them understand that, again, it's normal. We all have it, and we all struggle with it from at points and need help, again, in different ways.
I really like what Ms. Garcia said about the integrating care, and to plug UTMB a little bit. One of the things that we've been doing is integrating psychological care in our primary care department. So I mentioned that I'm an OB-GYN, so we have 2 psychologists, myself and Dr. Julia Poritz. And it's really nice, like where Dr. Poritz works in a comprehensive women's center, so that patients don't have to go from one place and to another place to see a mental health professional, that they can get their kind of one-stop shopping for healthcare, including mental health care. And I do think that's the way of the future. I hope it is. I think that's what that insurance and is going to support in the long term, especially for those like walking wounded people that we talked about.
And I love how you guys mentioned in the analogy that y'all gave that, you give medications for the chronic issues that you may have, like blood pressure. And so you talked about the medications for mental health, and we've talked about therapy. What is therapy? What are the modalities that are used to help to treat? Because it's not just medication. Like I think Jesus had mentioned, it's not just medication for your diabetes, it's also eating right and things like that. So can you talk a little bit more about the modalities of therapy and what that really means?
So I'll go first this time, so that way Dr. Temple doesn't have to worry about going first every time. But again, when it comes down to the modalities, again, a lot of times one of the most common ones, and I know we use a lot of it here, is cognitive behavioral therapy. And so what we focus on is understanding that it's not what we do that affects our mental health, it's how we perceive what we do and what happens around us. And so we identify these negative thinking patterns, again, that unfortunately we have. Again, regardless of the experience, we can create these negative beliefs that sometimes create increased anxiety, increased depression. Perfect example, again, that I like to give is, again, somebody that has an interview tomorrow, again, they can start to believe they're not going to get the job. They don't know that yet, but they start to get anxious. And so the more they think, well, I'm going to mess up, they're not going to like me, I'm not going to get the job, then I'm going to end up homeless, I'm going to end up living with my parents for the rest of my life. And it just kind of snowballs into so much more. And again, it doesn't start with the experience, it starts with how they're thinking. And so a matter of managing that. So that's one of the main ones that I know that I've worked with and I've studied and has the most research out there is, again, and it usually is effective in most, issues that people will come to therapy for. And then there's again, solution focus is one that a lot of people will go to as well. And basically it's more brief. And again, they're just working on the now. They're not going to go too much into the past. They're going to work at what's the issue now? What can we do to help you with managing that issue? What works, what doesn't work, and just kind of very simple, a little bit more simple, a little bit more fast paced in regards to kind of dealing with, again, what's the issue they're coming to therapy for. And then I know with trauma and stuff like that, there's several other kinds of theories that are out there that, and even more being developed, that are meant to help with, again, specific trauma. And again, as we also talk about trauma being more than just one type of trauma, because I think that's the education part of the mental health that I think we're all kind of obligated to do. And we all do, I'm sure we all do a good job of trying to do that, that what is trauma and what can be identified as trauma? Because most people identify trauma as, again, war, PTSD is identified with, again, veterans and things like that. But as we know, again, Hurricane Harvey created a lot of increased cases of PTSD for a lot of people because of, again, what that did to so many people with their homes being lost and with being without electricity and things like that too. Car accidents, again, could be traumatic. Again, abuse and neglect. I worked with CPS for 7 years, and again, I've seen it firsthand. There's a lot of, again, trauma from abuse and neglect. And so with that, I know there's, again, specific ones that are a little bit more, again, focused on working with those as opposed to, and it might kind of go hand in hand with CBT and then some other ones to kind of add to that. So I think those are just a few, without monopolizing too much. I want to give everybody else an opportunity to kind of talk, but those are the ones that I know that I'm familiar with and I've worked with, again, closely.
Right. And I think something to keep in mind, in Jesus, you mentioned pastors and pastoral counseling and maybe other community members that may be providing counseling services within our areas, is that therapists and licensed clinicians are going to be using many times CBT, so cognitive behavioral therapy, and other theories of psychology. Many of them overlap in that they address whether the patient believes they have the ability to make the change. And then the technique is going to many times be driven with motivational interviewing, which addresses the stages of change. So sometimes the patient isn't ready to start making an action towards the change, for example, setting a boundary or changing their eating habits or stop smoking. They aren't ready to do that because they still feel that smoking or eating sweets or whatever they're currently doing is helpful to them in some way. So they might be in the pre-contemplative stage of change. And so those are techniques that during the sessions, the therapist or the psychologist is helping them to evaluate where are they in their stage of change towards that behavior, to listen to why they feel that they're in that stage, and then maybe help them to gain self-awareness around some of the barriers or some of the challenges or the reasons why they feel that they are in that stage. And so just kind of going back, in the community, we have lay people, we have licensed people, we have different individuals that are providing counseling and advice, well-meaning friends and family. But it's so important to kind of evaluate where your friend is as you provide that social support, and how ready are they to actually make that change, or to go ahead and even when you're making an attempt to encourage them to seek out professional services.
Yeah, I'll also just add one quick thing, is that the research is very clear that talk therapy is just as or more effective than medication with many of our disorders. So, I mean, there's some things like OCD where talk therapy is substantially better than medication. That being said, I'm certainly not anti-medication. I think it's definitely has its place, and if nothing else, can be a catalyst for change to get the person to where they can benefit from therapy, whether it's cognitive behavioral therapy or motivational interviewing or solution focused. But you just want to plug that to talk therapy is not inferior to medication.
Absolutely. Thank you.
Let me just add one more. I forgot again. In regards to the modalities, again, one of the most kind of obvious one is, again, individual versus group therapy. And again, like I said, again, I know we do both here in the program, and I know other places provide both. Again, when I was in the schools, again, I did individual as well as group. And again, group therapy definitely can be, again, more beneficial for some and for some issues as opposed to individual. There are some people that, I want one-on-one, I need more focus time. And again, if they're identifying that, then I think it's good to give them that as opposed to throw them in a group and say, well, just do this and see how it works for you kind of thing, right? So I think like Ms. Garcia was saying too, again, determining where they're at that on that stage of commitment and motivation. And again, if they're ready to change, then again, because I've had mandated clients too. And again, it definitely is not the same thing as having somebody that's coming in on their own. Again, they're definitely fighting it a little bit more. And again, you can tell they don't want to be there and they're not engaging with you as much. You're going to break down a little bit more of those walls to get them there, as opposed to somebody that, okay, I'm tired of feeling this way. I'm tired of that. I'm ready for a change. And so definitely, I think that's important to recognize. And then linking them up with the right services, individual, group, family, whatever it may be. I mean, I think that's very important too when it comes down to the options that are out there for them.
Yes. And I kind of chuckled, Ms. Garcia, when you mentioned the stages of change, because I just had this discussion with my 17-year-old, and we laughed that somebody's been in the pre-contemplation stage for quite some time. But it was funny because that is real. Like it's real to identify what those are. I'm going to move a little bit into talking about the pandemic and how it's mental health has been affected through COVID. What have been the major mental health issues that have been reported or observed by the public related to the pandemic?
The pandemic has been a perfect storm for mental health problems. We are. And I also find a silver lining. So if I forget to say that, please someone remind me. But we are social beings. We like to be around other people, and our interaction is what saves us to a large extent. So by not only having to worry about getting sick and illness, now we have a lot of us have economic loss, economic disruption, housing instability, childcare worries, all that stress. And oh, by the way, we don't get to have the social support that we used to have to get us through these types of stressors. So it really is just a perfect storm of bad stuff happening. And so I think what my message to folks is that it really is, at this time especially, okay to not be okay. You know, I think to a large extent, if you're doing fantastic right now, I might actually worry about you a little bit. I think we're all struggling to some degree, and that's okay. And so going back to my silver lining is, I think that the pandemic has done a couple of things for us. One, it has shown us how important mental health and behavioral health is. That I think that us therapists and psychologists and social workers, maybe we'll start to get the respect and that we deserve in terms of funding and insurance parity, and getting us more out into the community where we belong, or wherever we are. But just, we need more of us. We're undervalued and underfunded, and not present as much as we should be throughout Texas and throughout the nation. So I think that the pandemic has shown that. I also think the pandemic has shown us that we really do like people. You know, like I think a lot of us pretend like we're misanthropes and hate people, but at the end of the day, man, I miss going to bars and going to sporting events and just hanging out with people that I probably used to make fun of. I just want to be around people again. So I think that has taught me that not to take my social hour, my friends, for granted.
Yeah, and I think definitely, again, piggybacking off that, I think, yeah, I mean, that the fact that, again, we wish we wouldn't have had dealt with the pandemic, but again, it definitely has shined a light a little bit more on, again, and I think opened the eyes to some people that never even identified with what anxiety, depression, what, again, that really felt like, what change and adjustment could be created. And I think one thing too, that it definitely kind of, like Dr. Temple was saying, again, the social aspect of it. Yes, we are all social beings and we all need to be around people. I mean, maybe not forever, but again, we need that interaction and we need that support. And I think another part of it was, it took away our ability to do some of the things we used to do to cope with the stress, just a normal day-to-day stress that we would normally do, like going to a game, or even self-care, going to get your haircut. You couldn't even do that. I mean, again, to the point to where, again, these things that were normally our go-to, our behaviors that we would do to de-stress, they basically were taken away from us as well. And I think that added to the ones that were already dealing with anxiety and depression, I think it just worsened. And then there were some that, I mean, increasing new cases of anxiety and depression throughout this, again, pandemic, I think. And as you know, again, you've heard, again, divorce rate has gone up, again, significantly throughout, again, this time. Domestic violence, I think, is also another thing that's gone up as well during this pandemic, because, again, people were basically forced to be around each other. And again, I mean, I know I love my wife, but 24/7 with her definitely, again, it's going to be something we have to adjust to. So again, she stayed home because she's a teacher. I came to work. So again, we still had some form of normal interaction that we had before. But again, it definitely is something that it was a forced change. And I think that's another thing that sometimes people don't identify, is how significant change can impact our mental health. And so this forced change of being told what we can and cannot do compared to what we normally did is definitely something I think that it created a lot of issues for as well.
And I'm going to say, just because Jesus mentioned this, another silver lining is that my wife and I came to the conclusion that she really likes when I travel, and I really like when I travel, for the very same reason, because we're not with each other. So I think that, you know, we realize that sometimes we're okay to be apart.
That's so good. You know, I love what is being discussed right now about the social isolation and also the pressures that have been placed on families. One other key pressure has been the financial and economic climate here with COVID, job loss, and the difficulty of women staying in the workplace, as often women are the ones in the family that have a primary leading role in childcare. And so we've seen a lot of decline in the women in the workplace, and has resulted in from a 2-income household to a 1-income household. And we see that also as a contributing factor to divorce and to some of these family dynamics that have been described. I wanted to talk about a little bit with our clinic in here in Brazoria County that we all have access to is the Greater Gulf Coast Community Network. The abbreviation is GGCCN. With those of us that are here in Brazoria County, we're able to do those referrals within our network for patients and clients that are saying that they are having a loss of income or difficulty having access to housing. And we're able to refer within our network to those resources that are able to provide. The GGCCN provides for food access, utilities, medicine, clothing, childcare, local transportation, and health supportive services, and are able to be screened for eligibility by one of the eligibility specialists. I believe UTMB has eligibility specialists. We have this here at Community Health Network as well. And so these are resources that we're able to connect our patients to within our county.
That's awesome. That's awesome. I do want to get into the resources towards the end because I want our audience to know what resources are out there. So thank you for bringing that up. I did start that in my notes here. But Nivea, you brought up a good point about the social pressures and some of the economic changes. Do you know, the panel here, do you guys know if there has been an increase in like domestic violence, child abuse, anything with the elderly? Or have we seen a rise in any kind of cases of that due to the pandemic and these issues that we've kind of mentioned?
Absolutely, all of the above, and I think we would all agree on that. We have seen an uptick. We are seeing an increase in, unfortunately, child abuse, trauma cases that are being referred over to our clinic that are court mandated. So these are issues that we seek to treat, but I'm sure Dr. Temple would agree with me. We seek to prevent. How can we provide these families the support that they need? They are living in the real day, every day, in the middle of this crisis, this pandemic, lack of resources to handle their very needs. And they don't have the credentials behind their name, and they don't have a licensed psychologist or therapist living in their home to help them 24/7 to figure out these very, very difficult challenges. So how can we feed resources and information and education and knowledge back into the homes to the adults that are making the decisions in those households to alleviate the burden of stress? I think that's really the burden that we have here as, yes, health clinics and hospitals and organizations, but how can we expand our outreach efforts to put that information into the hands of our families in terms of education, I think is always the greater outreach.
I think one of the crazy things, going back to what Ms. Garcia said, is the child abuse at the start of the pandemic, it actually looked like it was decreasing now, but that was artificial, right? Because who are the main reporters of child abuse are teachers and school nurses. And so with kids not going to school, those mandated reporters weren't reporting. So it looked like child abuse was decreasing, but in fact, to Ms. Garcia's point is and Jesus's point, with the increased financial stressors, stay at home, we would expect, and I think that it has panned out, the child abuse, not only the frequency, but the severity of child abuse increased over the pandemic. And we have actually done, so this is the topic near and dear to my heart, is we've looked at domestic violence in the pandemic, during the pandemic. Dr. Leela Wood, one of my faculty members, has been really intimately involved in this and has indeed found increases in domestic violence. And also the staff who work in these domestic violence shelters are seeing increases in stress. These are people that are often have a history of abuse themselves, that are underpaid and overworked. And so the pandemic created that much more stress. And so one of the initiatives that we did here at UTMB is through a partnership with Texas Council for Family Violence, is we are providing free therapy to telehealth to the staff at domestic violence shelters. So basically we're trying to, and lobbying for them to be considered essential workers so that they get the same help that other essential workers get. So it's a really cool resource, and we're trying hard to make this, we only have a limited amount of funding and number of people we can provide therapy to, but it's something that we're looking to expand. So I'm really glad you mentioned that question.
Thank you. Thank you. And on that same topic, so like let's talk about maybe the different age groups and how they've been affected and the ways that they've been affected in the pandemic. Are you seeing more of one type of mental health issue in specific, like maybe the children versus adults versus elderly? Are we seeing a specific type of increase of mental health in by age group?
I think so. I mean, sorry to monopolize. I'll promise to be quick. But with kids, all ages from really newborns to 18-year-olds, they're not, with the pandemic and with the stay-at-home orders. I have a 16 and 18-year-old myself, and they're just not getting the milestones, the developmental milestones that you would typically see. Getting autonomy from parents, going on dates, doing spending the night over at a friend's house. They're not able to do that sort of thing. And younger kids, it might be socializing. The good news is that kids are resilient, and for the most part, they'll be okay with this. The bad news is it really sucks. They're angry and frustrated and sad, and it is going to take some rebuilding from all of our parts. And then I think with elderly folks, not to mention all the folks in between, but this is supposed to be the time that they reflect on life and share memories and not have to worry about financial stuff. And now with the pandemic, that's a lot of that has been affected. So I think all in all, and excuse my French here, but it's just sucked for everyone. So I think that we're going to see a third wave of the pandemic, and it's not going to be viruses. It's going to be mental health problems.
Absolutely. And I love what Dr. Temple described, and I love the personal story too. I come from somewhat of a dynamic and familiar with enmeshment. I'm Hispanic, so there you go. I think it's just in our culture. And I was doing some research on the topic of enmeshment, and it was talking about when there's a natural disaster or some sort of event that requires families to coop up and live really closely with one another, it can cause an enmeshment dynamic. And lo and behold, here we are with COVID, where we're all cooped up with one another for a year plus. And this type of dynamic can lead to trauma. It's actually called enmeshment trauma, as I'm sure both of you are familiar, but I'm saying this for the good of those who are joining us today. But the good thing, like Dr. Temple says, there's always a silver lining, and these things are treatable. We can heal from them. And through education and through therapy, we can overcome these types of dynamics. Not forever.
Yeah, and again, in regards to, again, I think definitely agree with both, again, Ms. Garcia and Dr. Temple, in regards to, again, from kids all the way to older adults. And again, I know we worked specifically with the older adult population, again, 55 and older, a lot of them in that retirement age, a lot of them in that reflection kind of thing. But I think a lot of it was also, they were the high risk population. I mean, they were the ones that basically were even more anxious than, again, even the younger generation, because the younger generation, again, I know it's me too. When I was younger, I felt invincible. I was like, oh, if it gets me, I'll be okay. But our older population, again, they were definitely, again, a little bit more, vulnerable to, struggling with, adjusting to that mental health aspect of it, being basically, and then also, again, they lost. There was a lot of loss that they dealt with in regards to some lost spouses, some lost, again, family members, again, friends, because, again, that population was the one that was dealing the most with, again, the deaths and things like that in the beginning, and even now. And in regards to, again, I think the children part of it, it definitely, again, I have, again, a 16-year-old all the way down to an 8-year-old. And again, they all had different kind of reactions to it, again, depending. And again, I joke with my wife that, again, in a few years, you're going to see a difference in this generation than you're going to see, because, again, they did miss out on some things. I mean, even working with, again, older, again, seniors last year missed out on, again, a lot of things, graduation, prom, all those things. I mean, sports that they were looking forward to. So, I mean, that loss. And so that's another thing too that I think is important to kind of educate, that what loss is and what it isn't. And then a lot of people identify loss as loss of a loved one. But again, loss of that opportunity, loss of that experience is also something that I think a lot of people maybe kind of look over. Oh, well, you didn't get to play baseball, you're okay. Or you didn't graduate. Again, suck it up and just go on with your life kind of thing, right? So, but as we know, again, we enjoyed that. And again, I think it's about empathizing and saying, you know what, I know that's hard. I know that takes a toll on you, not being able to do the things that you want to be able to do. and they were taken away from you without warning, basically. And so,
I'm jumping in. Jesus, you just reminded me of and there's some sort of warning going on in our hospital. So sorry for that noise, but I remember my daughter, she was a senior in high school this year, and she was really distressed at the beginning of the school year, not getting those milestones. And I didn't handle it right? I'm a psychologist, I'm supposed to be able to, but I was kind of like, suck it up. Like, people are a lot worse off than we are. Like, what's your problem? And then it finally started to hit me, and I was like, man, it's terrible. And I went back to her and apologized, and we talked it through, and that it's not fair. And so I'm glad you said that, Jesus, that had personal meaning with me.
Yeah, and then again, we all do it. And again, like I said, even me, I tell people, just because I'm a therapist doesn't mean, again, I don't need therapy myself. And again, like I said, I don't struggle with, again, dealing with those things. And again, like I said, with my kids, I saw different things. Again, when school was canceled, they were excited. Again, they were like, yeah, but after a few weeks, they were like, I want to go back to school. I want to see my friends. I want to, again, even birthdays. I mean, not being able to have parties and things like that. Again, it was those things that basically we took for granted that we didn't realize, again, were going to be so significant for them to not have until we started seeing their reactions to it and their moods definitely, again, being impacted. And again, like I said, all the way from children to adults. I think, again, there's been some significant, again, increases in all those areas.
I just have a couple more questions before we open it up to our guests. Your facilities, do you guys offer same-day access for therapy and psychological services?
I know ours does. I think where it might be a little bit different than the other two organizations being represented today. As an outpatient network, we do have same-day access for new patients included. If a patient has a pre-existing history of seeing a psychiatrist, we're able to accommodate for same-day psychiatric services, especially if they've been out of their refills for a while. For whatever reason, didn't have that follow-up for therapy as well. We're able to accommodate. And then we're also able to screen for crisis and those types of things. If we have a family member that any of us know that are stating wanting to harm themselves, wanting to harm someone else, that's something that should be taken very seriously. We should never be in a position where we're thinking that our friend or our loved one or even our kid is saying or thinking things just attention seeking. We really want them to get in front of a licensed professional to have that evaluation. And we're able to accommodate from the convenience of your smartphone, a virtual visit, and let's get them seen. And so it's very important to be able to get that care that our family needs.
Thank you.
I'll say quickly, I think we could use more of us. So UTMB has been supportive in growing psychological services, and we can accommodate. Same day might be difficult sometimes, but we can definitely accommodate. I will say that in looking at the question and answer, I don't know if you want to get to this, but Dania, I'm sorry if I'm mispronouncing the name, asks a really good question that I think y'all could answer better than I can.
Yeah, well, definitely, I've seen that question too. In regards to same day services, again, depends on what it is. For the group program, the older adult group program, usually it's not going to be the same day, but it could be the same week because, again, we're going to get them in that program and seen by the doctor within a week at the most. Just because with the hospital, again, there's different steps that we have to take a little bit more than, again, I guess an outpatient clinic would. But again, I'm definitely glad that, again, they're able to do that for them because that's definitely, there are times where, again, they need to be seen immediately. And again, I know one thing about being in the hospital as part of the hospital is, again, if we have patients that come in or clients that come in and start to express those suicidal or homicidal thoughts, ideation, then again, we definitely can get them to the emergency room, which is right down the hallway, and get them in the process of getting inpatient treatment as soon as possible too. So again, like I said, it just depends on the situation sometimes. Mm-hmm.
Thank you. Thank you. And thank you for letting us know that there's also some virtual options there. Let me get to the question from Danya. How well do you think that Brazoria County community is doing in relaying this information to the Hispanic community, considering the language and cultural barriers?
We currently have a Spanish option on our website, so it's mychn.org. Our behavioral health services are published, everything that's been discussed here today from the group, such as individual therapy, group therapy, we have play therapy, art therapy, bipolar group, psychiatric services, and our services are able to be accommodated for bilingual patients. We do have bilingual individuals on staff, including providers, and so we can provide that care directly, and or it can be accommodated via interpretation services to our Hispanic population. But to answer the question, yes, that information is available in Spanish through our website.
As far as I think as a whole, I mean, I think again, there definitely is room for improvement. I mean, just like with anything else, I don't think anything is ever again met to a standard where okay, it's perfect and now we don't have to change anything. I think it's a matter of recognizing okay, where are the holes and how can we reach that community a little bit more, whether it's through again awareness events or through again internet-based kind of things. Again, I know personally with me, again, I get onto my parents every time I see them because again, very fluent in Spanish, but never spoke to me in Spanish. And so again, I can pass a conversation, but therapy in Spanish is a lot more difficult than again, holding another conversation. We do have translation services that are available again, as needed. But again, like I said, again, I think therapy through a translator, again, I'd rather be able to have somebody that speaks fluent Spanish with them because again, sometimes it's even with the translator, something can get lost in that kind of thing. So, but I definitely think if that's worst comes to worst, if that's what we have, then we're going to use it because we'd rather use that than nothing at all, and then have that person not get treated. But I definitely think there's always room for improvement, and maybe even getting in touch with the community and doing a needs assessment is like, how could we reach y'all better? How could we help get to you better and let your population, again, our population know again that you know what's available to you kind of thing, whether it's a resource list that we mail out to everybody, whether it's again, like I said, awareness events where we can hold again, not just virtual roundtables, but maybe a community-wide kind of event where they can kind of just ask the questions they want to if they're there. And then education, I think education is the big thing part of it too, just understanding what it is, because as you know, with our culture, unfortunately, again, we're very, very reserved. Again, we don't really talk about any of our problems outside of our family, and sometimes even not with them. And so I think a matter of breaking through those barriers, I think is also something that, again, we kind of need to work on to help them understand that, again, therapy isn't weakness, therapy isn't bad, therapy isn't something that we have to avoid or see as something that's not needed. And more so that, okay, you go to a doctor for health, you can go to, again, a mental health professional for health just as much kind of thing, right? But even then, I know, again, from my dad to my mom, even healthcare is something that we kind of tend to avoid for the most part, again, for just because, and I think that's part of it too, is just kind of changing the culture and the belief and understanding that healthcare is not a bad thing. It can be something that can help us improve our lives in so many different ways, from physical to mental kind of thing. So.
But some of us we're not ready to give up our tortillas.
Yeah.
The last question that I want to make sure our audience knows is about the resources. Can you guys give us a list of resources? I know, Nadia, you talked about the Greater Gulf Coast Network, and Dr. Temple, you mentioned there was a Texas Council. Talk to us about the resources before we let the audience go, so they know where they can go get some help. If it's your website, if you have resources available through your website as well, please can you talk about those briefly. I want to be respectful of y'all's time. I know we got about 5 minutes left, but I definitely want the audience to know what resources are available to them.
Sure. For us, it's our website, mychn.org. We've actually built in screenings that anyone can take. So Jesus mentioned the Hispanic community sometimes being reserved, especially on the topic of mental health. It's a private way that an individual can go and, just through their smartphone, go to mychn.org and quickly take an anxiety or depression questionnaire and receive those results immediately and see where they lie. And then if they have a moderate score or even mild, they're able to go ahead and reach out to schedule an appointment with a mental health provider. Again, these visits are 100% confidential. So, if you or your loved one is someone that's seeking these services, you don't have to go in to the clinic. You can get these services privately from your smartphone behind a locked closet door somewhere. This is something that you're able to access if that's one of the barriers that's holding you back. So those are the resources that we have to offer, is mostly going to be through our website.
Yeah, and then same thing with us. And again, I know we have a list of resources for counseling services in the, again, Brazoria County area, from Brazoria to Angleton to Lake Jackson. Again, we definitely, again, post for different providers, because that's another thing too that I think is important for us to recognize, is that if it's not us, at least let it be somebody. Because again, the most important thing is that they're getting the care they need. And again, we may not be the best fit for them, and that's okay, because the most important thing, like I said, is for them to get the care they need. So they can definitely go to our website. And again, I definitely is something that, again, I can always print out and give to, again, community events in regards to counseling as well as psychiatry. I know psychiatry in the area is very sparse. There's not really too many providers in the area, but again, we definitely want to make sure people know what we do have and that it is available for them to use for sure. So,
and for us, we have a resources on our homepage, the Center for Violence Prevention homepage. It's utmb.edu/CVP, as in Center for Violence Prevention. And also, since you guys mentioned all these great local resources for people that maybe listening or could benefit from giving someone else this number, the Suicide Prevention Lifeline is 800-273-TALK or 800-SUICIDE. So those are things that people can reach out, and it's staffed. And I believe, don't quote me on this, but maybe you guys know that there's also chat services available at some of them. And I should have probably looked it up before I said that, but I could find that out. But I think it's especially good for folks that like teenagers who'd rather chat through text.
I just want to say one more thing. I know we're wrapping up. The best resource this community has is you, the viewer, whoever you are that is watching this today. You've had the opportunity to join us and listen to these tips. There's nothing better that you can do than to share this information with your loved ones, with your family, with your friends. And a few of us have mentioned, needing more providers in this county, and needing more Spanish-speaking providers in this county is a huge need that we have. So encourage your young people, your teenagers that are, especially those that are Spanish-speaking, to go ahead and consider a career in mental health and become the solution here within our county and for our families, and be that resource.
And lobby policymakers to increase our funding.
Yes.
Yes. Well, I'd like to thank each one of you for participating today in this event. It's so meaningful. May is Mental Health Awareness Month, and so we're so glad that you guys were able to take some time out and present this information, this informative information to our audience. And if we at least reached one person today, that makes my day. I don't know about you guys, but that totally makes my day. So again, thank you again. Thank you to the Brazoria County Hispanic Chamber of Commerce for putting this on, UTMB, Sweeney Community Hospital, and CHN for all your hard work and dedication to our community.
Thank you so much for having us, and thank you other panelists and hosts. It was fun. Thank you all.
Thank you. Likewise.
Thank you.